Hello. Thank you for giving me the opportunity to present to you today. My name is Hilda Benitez, charge nurse for Perinatal Unit at Kaiser Panorama City. I am also working on my master's in nursing with emphasis in leadership. I am here today to present to you a strategic plan on how to improve the hospital consumer assessment of healthcare providers and systems star rating of the Panorama Perinatal Unit in terms of patient satisfaction with nurses' communications on how patients rate nurses in listening and explaining things in terms patients understand. Now, why is this important? HCAHPS is the first national standardized publicly reported survey of patients' perspectives of hospital care. Research have shown that a good communication between nurse and patient is essential for the successful outcome of individualized nursing care of each patient. At Kaiser, nurses are empowered to use the nursing professional practice model to standardize nursing care as well as move the profession forward. Given such a powerful model, one would ask, how come the HCAHPS are not at 5-star rating? So, a thorough SWOT analysis was conducted to identify the strengths and weaknesses that we can improve upon. Some of the weaknesses identified are due to short staffing and high patient turnover. Nurses feel that they are more task-oriented. Nurses verbalize that they are overwhelmed with the task that they are unable to provide patients with a more quality time because they appear to be rushed. Some threats identified due to this is that new or contractual travel nurses who are in the unit for just a period of time are not familiar with the Kaiser's professional practice model and are not standardized with their care. Despite these weaknesses, strengths identified are that nurses and perinatal units have high job satisfaction because they have a good camaraderie among each other. They also practice good teamwork. Opportunities that were identified to help improve nurse communications are the use of communication tools available to nurses, such as the Nurse Knowledge Exchange Plus or NKE Plus that is used for handoffs. Qualified bilingual staff is available on site. A video remote interpreter for patients who speak languages other than English, as well as Get Well Network. It is a television where patients can see educational videos, see who their provider is for the day, their goals, and so forth. The strategic goal is to increase the HCAHPS star rating on nurse communication, on how patients rate nurses in listening and explaining things in patient terms patients understand. From a 3-star rating to a minimum of 4-star as measured in January 2018 to December 2018. To guide us, a strategic map was developed to ensure that the business processes were in line with the organization mission. Learning and growth goals would include improvements of nursing communication by means of annual training, competency check, and team building seminars. The unit-based committee team will be utilized as a playground on how to improve the nurse communication in the perinatal unit. Also, nurses who speak languages other than English will be empowered to become qualified bilingual staffs. Improvement in nurse communication will support the internal business process and foster a synergistic and respectful environment among all stakeholders. customer service will be affected by these changes and can expect nurses to utilize the available communication tools to increase trust in patient nurse relationship. Also, excellent nursing care will be rendered and strengthened by the evidence based practice. Consequently, financial performance will reflect a positive profit margin because of the growth of the membership, as well as minimize the litigations or lawsuits due to miscommunication and negligence. So, with your approval and support, we can collaborate with the maternal child health to improve nurse communication on listening and explaining things in terms patients and their family can understand. The manager can introduce the campaign to the staff in the next staff meeting. Charge nurses can huddle the staff to each and take a moment and redefine why did we become nurses in the first place. This hopefully will help nurses take a moment and not rush. The timeline is within the next 3 months, nurses will have a skills training and be validated on the use of the communication tools such as the NKE Plus, video remote interpreter, use of the qualified bilingual staff, and proper documentation of the tools used. A nursing communication champion can be identified or selected per shift to help the staffs, especially the new staffs. Also, charge nurses will round on each patient to ensure that every patient and their family are understanding their plan of care. Within the year, ongoing monthly meetings through the unit-based committee will be utilized to discuss and analyze data on the HCAHPS scores. Also, a pre and post data campaign will be launched to monitor the trend of the scores. So, if there's any improvement, rewards and recognition will be given. And if there's any decline in the scores, then the UBT or the unit-based team will discuss ways on how to improve the scores, as well as conduct open discussion between all staff to ensure every input is provided. To communicate the process of the plan, formal and informal communication will occur using various forms of written and visual communication. If given the opportunity, I will be sending you an email of the proposal of the campaign by means of skills fair and training seminars. I will also include validation tools to ensure that nurses are compliant. I will also meet with the upper leadership to provide updated data of the HCAHPS scores in your quarterly meetings. I will meet with the unit-based team regularly for progress. I will also help reinforce to the charge nurses to conduct shift huddles just to remind nurses of the communication tools available and be in compliance with it. To evaluate the success of the strategic plan, we will be using the feedback control method. The HCAHPS scores on the patient satisfaction survey on communication from previous year as provided by the director will serve as a baseline to compare any improvement on a month-to-month basis. Also, the inpatients are surveyed daily, whether the nurses are explaining things in terms they understand, as well as the doctors. Based on their responses, an email is alerted or sent to the managers if there are any negative comments. So the charge nurses can go and do real-time service recovery. Every member who sees a provider, whether inpatient and outpatients, are also given a survey through mail. So these results will be accounted and then graphed in a monthly chart to see which areas nurses and providers need to improve upon. The nursing profession exists because there are people who need us to advocate for them, at the same time act as their health educators. But if patients do not understand us or we do not listen to their needs, then I feel like we fail as nurses. Studies have shown good communication improves the quality of care in patients, and it is evident by the results of how they got better and improved. The best expertise, training, and continuing education of nurses in matters relating to the proper technique of communication will enable them to respond adequately and humanely to the expectations of patients. In conclusion, I ask for your support in providing resources in this campaign to provide better nurse communication. With your help and collaboration, we can achieve greater results. Boost nurse morale, because if they see that leadership are backing them up, then they know they are being valued. And then they can also make difference in their patients' lives. Thank you so much for your time and your consideration of my proposal. Feel free to ask me, email me if you have any questions. Thank you. Have a good day.